Good afternoon. Oh, okay. Can you hear me now? Is it better now? Okay. Good afternoon, everyone. Welcome to the first seminar by Academy for Women Entrepreneurs. My name is Adebisi Odeleye. I'm the Secretary General of the association, and I'm so excited and happy to see everybody here this afternoon. We are in for a very great time, but before we go on, I would just like to say, if you're here and you can hear me, please drop your name and say hello in the comment section. Just greet everybody, say your name and your business name shortly. We just have like 3 minutes to do that, just brief. Imagine that we are meeting in a live space and you're trying to catch up with your old friends. Please just send a message, greet people around, and let's just feel as if we are all in the same room. Yeah, Imutianya, I can see you. Welcome on board. Hi, Stephen, I can see you. Ugo, I can see you. Hello, welcome on board. Good afternoon. I'm so happy to host us this afternoon, and we'll be getting right into the event of the day. Shortly, I'll be introducing Dr. Yemisi, who is the president, to introduce Stephen Ubeli to us, who is the PR Public Affairs Officer of the U.S. Consulate. Before we go ahead, Dr. Yemisi, are you on here? Hello, Dr. Yemisi. Hi, Antonia. Good to have you here. I'm trying to catch up while I wait for Doctor. Oh, hi, Joy. Welcome. Good to have you here. Hi, Sheung. I can see you. Debola Adefioye, I can see you. Ademola Adeyeye, I can see you. Everyone, welcome, welcome, welcome. I'm trying to wait for Dr. Yemisi for the introduction of the Public Affairs Officer. Dr. Yemisi, are you here? Hi, Shaya, good morning. Good afternoon. I'm saying good morning, good afternoon. Okay, it seems I can't get Dr. Yemisi right now. I'm just going to introduce Mr. Stephen Ubeli. Is the Public Affairs Officer of the U.S. Consulate, Lagos, Nigeria. We are so happy to have you here, and we are delighted to have you. You know, I've seen you at different occasions show interest in entrepreneurship, show interest in everything that pertains to women, and we are so honored to have you in our midst today, sir. I'll give the floor to you right now to give us your opening remark.
Well, thank you very much, Adebisi. Thank you so much for welcoming me. Thanks so much for this wonderful event. And then, of course, my deep regards to the president, Dr. Yemisi Adeyeye, and of course, one of the speakers, Dr. Ademola Adeyeye as well. It's really wonderful to see here because it is the inaugural event for the Academy for Women Entrepreneurs Alumni Association, which is just incredible. I know we had a major opening a couple of weeks ago now at the Consul General's residence, which was really, really, really amazing. And I know our Consul General really enjoyed, really enjoyed the event, and always loves hearing all of the great success stories. And I would be remiss in not just reminding people that we do love to post on your successes on our social media sites. And so Douyin has information on that. There's a Google form that you fill out where you can upload some pictures and a little description of what you've done. And in that way, we can post about all of your wonderful initiatives and wonderful successes throughout Southern Nigeria. And really, congratulations to all of the outstanding women entrepreneurs who make up this really one-of-a-kind alumni association led by Dr. Umisi. And of course, all of the AWE executive committee members who also contribute a real amount and a real bulk of their time. We are so grateful to that. And we hope this will help the members. One thing that really strikes us about AWE is it's not only an entrepreneurship training, but it's really mentoring, it's really network. And it seems that through the training with our partners, Ascend Studios, that there really is a sense of community that's established, and people help each other, and alumni help each other, which is an amazing thing to see. And that, even creates more power, I think, for the entire network. In Southern Nigeria, we currently have actually 10 active alumni associations, ranging from our United States Government Exchange Alumni Association, which is really a flagship and an umbrella organization. We have Tech Women, the IVLP, the International Visitor Leadership Program, Fulbright, the Mandela Washington Fellowship, the Yali Network, and CFAN, which is the Carrington Youth Fellowship Alumni Association of Nigeria as well. And each of them are really working hard to improve their communities through numerous outreach projects and impactful initiatives. And we at the Consulate are very excited to really have the AWE Association as our 11th. So you guys are lucky 11 alumni association in Southern Nigeria. And so we're really looking forward to partnering and deepening and strengthening our bond as you guys achieve some of the very same successes that many of your colleagues in the other alumni organizations are doing. And it's really important, I think, also to reach out to those organizations, to cut across those alumni lines. Sometimes the alumni associations tend to be sort of in their own little channel, but we would love to, we'd love to see when there's some, cross-channel interaction with some of the groups, because it really does add power to them. The Yali Network, for example, they are just able to muster many, many, many people, many volunteers, because the network is so large, for example. So those are things that, that all the associations can leverage. And with regard to, medium and small businesses, or SMEs, as we call them, according to the National Economic Council, Nigeria has more than 37 million micro, small, and medium scale enterprises. And that is, by and large, the majority, the bulk of the percent of jobs, 84% of jobs in the country, and really significantly contributes to the GDP, the gross domestic product of Nigeria. It's almost half of the gross domestic product of the entire country. And so organizations like this, businesses like this, enterprises like this are so critical for the future of Nigeria. And going further afield, investing in women is a very smart investment. If you look at any study, women who do well invest in their families, invest in their communities, and indeed invest in their societies. And so you see great progress when women's empowerment and economic integration are critical and pivotal parts of any country's long-term economic development, and that certainly includes Nigeria, if maybe even more so. because of the great opportunities here in the very, very large economy in Nigeria. And so entrepreneurs like yourselves have really a crucial role in Nigeria's economic growth by creating jobs that lead to a more prosperous and stable economy. You all are a growing market force, serving as a critical source of innovation and job creation, and indeed fueling economic growth. And so I'm really pleased to participate in this program. I'm really so glad to be here, and please take what you learn from being in this association to also grow your businesses, improve your life, and indeed contribute and continue contributing to Nigeria's growth and its future, because you are the future of Nigeria. You are the face of this country. And so it's so wonderful to see this kind of growth happening almost in front of our eyes. So thank you so very much.
Thank you so much, Stephen, for that wonderful welcome address. Thank you for helping us see ourselves, as women, as change agents, and also a growing market force, and the importance of women, in the growth of the economy. Thank you so much. We appreciate you. We appreciate your presence, and we hope to always see you around whenever we call you. Thank you so much, sir.
Very welcome.
So right now, I'm going to introduce go to the major events of the day, which is talking about women, prosperity, our health, your health, and you. It takes someone that is healthy. It takes someone that is strong enough, to lead an organization, to the next level, to be a change agent, to push the frontiers in the economy of the country. So I hope everyone is here with their writing pads and notepads, because the topic we are going to be talking about today is quite an emotional one that affects women and, our productivity and the level of wealth that we can make, because, like an adage would say that there's a saying that says health is wealth, so just before we do that, and I'm so happy that our speaker is already in the house. But before we get right into that, I would like to introduce Dr. Yemisi. Let me just quickly read her bio. She's the president of Academy for Women Entrepreneurs, Alumnae Body Association. Dr. Yemisi is the co-founder and the managing director. He is a fellow of the Institute of Management consultant. Dr. Yemisi is the pioneer president of Academy for Women Entrepreneurs, and she has published a book titled Entrepreneurship is a Beautiful Thing. Please, can we welcome Dr. Yemisi, Madam President, to give our opening remark.
Thank you so much, Madam Jensek, for welcoming me. Yeah, thank you so much. And I really want to say thank you to God for the opportunity to be here today and to be addressing everyone. Before I go on, I want to recognize Mr. Stephen Ibeli, the Public Affairs Officer of the U.S. Consulate. Thank you so much for the warm opening remarks and the reminder that you have given us that we are the fuel for the economic growth of the nation. Thank you so much for gracing this occasion, our first online seminar. So we are new at this, and we will continually solicit your support and guidance as we go on. I also want to recognize other members of the public affairs section who are in the house right now. Thank you so much for being here. I think I saw Mr. Ibrahim in the house, maybe Jennifer, I don't know if she's in the house, but everyone, I want to say thank you to you. I also want to say, recognize the presence of the Ascent Studios led by Mrs. Inya. She's the program partner. And she told me that there's something going on now. She may not be able to be here at the moment, but I'm sure someone from Ascent Studio is here. So I want to recognize you. Thank you so much for being part of this. And to our guest speaker, thank you so much for honoring our invitation at such a very short notice. Sorry, there was a power outage. All right, so at a very short notice, thank you for coming. And we look forward to learning as women about our health, because we as entrepreneurs and also as women, we are very important to nation building, to growing the nation and also growing our families. And at the end of everything, we want to be healthy, to be able to enjoy the labor of our love to the nation and even to our family. So we need to be very healthy. So we look forward to learning what we need to do from you, our guest speaker, Dr. Ademola Adeyeye. And also I want to recognize the presence of other exchange alumni bodies in the house, most especially the USGEAA, the Central ESCO that coordinates all the other alumni bodies, headed by Mr. Mike. Thank you so much for being here. And to all our guests, because in the house today, we don't only have AW members, we also have guests, people from other exchange alumni, and even Nigeria and the world at large. People come in today to be part of this first seminar by AWE Alumni Association. Thank you so much. And to the awesome ladies, when I say AWE, I just want you to say awesome where you are. You are the real deal. Thank you so much for being part of this first seminar. We are doing so well because you are supporting us, and most especially to the ESCO Council, the Executive Council. You ladies, you are phenomenal. You are amazing. You are supportive. You are doing so much behind the scene, and you're making AWE Alumni Association to be an enviable association, not only in Nigeria, but in the world at large. Thank you so much for having me. And thank you so much, everyone, for coming. So I think we can get on with what we have to do today. So our darling moderator, by the way, you look so beautiful.
Thank you, Mom.
Thank you, yeah.
Okay, thank you very much, Madam President. So we go right into the topic of today. I am a little bit emotional about the topic of today because I've had people, I've lost people, I've had warriors, I've had survivors in this space, and that is breast cancer. As we all know, this month October is dedicated for creating awareness for breast cancer. And our speaker for today, while I was reading his profile, I was like, wow, woo. So let me just go ahead and read his profile. Dr. Ademola Adeyeye is an associate professor of surgery, a consultant general surgeon, a surgical oncologist. Through research, innovation, hard work, and devotion, has changed the face of cancer care in Nigeria. It represents Africa on the board of several global cancer care initiatives and medical associations. Dr. Adeyeye is the first from Sub-Saharan Africa to be certified as a surgical oncologist by the European Board of Surgery. Dr. Adeyeye is a fellow of many colleges, including the American College of Surgeons, the European Board of Surgeons, the West Africa College of Surgeons, and the World Association of Minimal Access Surgeons. Dr. Adeyeye is globally trained in different areas of surgery. I don't know. I want to read a lot of things, but I don't want to read too much again. He has worked with WHO, and the beautiful thing is there's a chairman board of directors of Life Force Hospital Nigeria. If you know the name of that hospital, I think you should ring a bell. That is where, okay, let me just go this way. And let's just welcome Doctor. I called yesterday when I was sending a message to the president. I said, please, can you send the profile of the first gentleman of the association? So can you welcome the first gentleman of Academy for Women Entrepreneurs Alumni Association it teaches us on what we need to know about breast cancer and how we can take care of ourselves. Thank you very much. Welcome on board, sir. Over to you.
Thank you so much for this. Can you all hear me?
Yes, we can.
Awesome. Awesome, ladies, too. Adebisi, thank you so much for the resume. Again, I kept on wondering whether that was the same person you were talking about. Thank you from that torture, because it's very difficult to continue to hear somebody tell your life story in front of you. It's like what people say that you're trying to barb somebody's head in his absence, but it's okay. Again, good afternoon, everybody. I'm so grateful to be here in your midst of discussion. I know we have a time frame, and I'll try to keep the time too, so that I don't bore you, and then we have time for questions. So, if you permit me, the topic for today is women's prosperity, your health, and you. And I've already been introduced. I have no disclosures that are relevant to this presentation. But I'd like to acknowledge again the Academy for Women Entrepreneurs Alumni Association for this invitation, as well as the U.S. Consular Office in Lagos for giving us this platform to have this interaction today. I know a lot of recognition has been said in the past, so I like to stand on that existing protocol. So usually as an academic, I always like to have a guide or an outline of how to approach the discussion. So I'll follow it in this slide. I'll give a preamble of the discussion, and then I'll focus on a particular aspect that will be alluded to. Then we'll conclude, and then we'll take questions. So the preamble is this: why should we bother about health with respect to our wealth? Well, I know that women, they desire they actually deserve to have fame, to have fortune, to have forward-looking careers. We desire, or you deserve as women, to drive the best of cars, to live in the best of houses, to be up and mobile in your different respective fields, and to be juggernaut and Amazons in wherever you lay your hands upon. And you should be ready to count money out of money, and be ready to be a positive influence to your family, to your society, and to the nation and the world at large. So that's the desire, and I'm sure that's one of the driving forces of people coming together as an association to make your businesses to thrive and to move forward, because you all deserve fame, fortune, and forward-looking careers. But you need to be healthy to enjoy these benefits. In fact, WHO defines health as a state of complete physical, mental, and social well-being, and not just the absence of disease and infirmity. So let's assume somebody doesn't have any illness, or is not physically well cash-wise, or is not mentally well, or is not socially well. That person is still not well. That person is unhealthy. So ultimately, financial security and prosperity are tied to our health. And it's been said already that health is wealth. But I have reframed it this way. And this is a quote I thought about this morning when I was playing this slide, that health is the foundation upon which wealth can comfortably rest upon. If there is no foundation of health, you cannot put wealth on top of it. It continues to sink, because people continue to spend their resources taking care of diseases and infirmities when they have to enjoy their lives. So I feel that health is actually the foundation upon which wealth will progress and prosper. And I think it's apt that we're having this discussion before other money-making seminars, so that we start at the back end, we start at our foundation, and then we propel ourselves forward. So, and again, I just need to emphasize the fact that our health should not be neglected in the pursuit of happiness. Even as you try to strive and what to call hustle and make things happen, also remember that you have a body that needs to be kept, that needs to be tended, that needs to be looked after for, so that you enjoy the benefits of your strive. Now, as an overview, what are the general tips I would like to give or to allude in terms of having a healthy lifestyle? I know most of us know about this. And so when I was preparing this, I tried to bring a different dimension to it. So I've condemned everything down to 8 Ds. So what are the 8 Ds I think we should pay attention to in terms of our overall general well-being health-wise? The first thing I think about is diet, because what you take in is what you bring out. And just to emphasize again,
so let's begin to explain that. I know there are some
tables, taking lots of fruits, lots of vegetables, lots of proteins, cutting down on fats and oils, and trying to be moderate with carbs, carbohydrates. It's very, very essential and important for us going. So we cannot overemphasize the aspect of what you take in. It's very, very essential. I know that we live in a society where fast foods have become the norm, where eating on the go has become the routine, but having a well-cooked, prepared meal with nutritious in condiments will make it very important too. Taking lots of water is so essential and very paramount to our health. In fact, medically speaking, an average human being needs at least 3 liters of water per day in the body system to function normally in this part of the world. In the temperate regions, they need about 2.5 liters of water. So if you're not taking enough water, it means that you're doing your body a lot of harm, because the body now starts to try for water from different angles or different aspects of the system. And so water is very, very important. Of course, cutting down on sodas, soft drinks is very, very essential. And of course, as a medical practitioner, I always advocate against alcohol. I know there are people who are supportive of it, but I'm very, 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 very passionate about it, because I've seen the effects of alcohol in my patients, those who have had alcohol liver disease, who have had cancers, who have had heart disease because of alcohol intake. And so everything has to be done in moderation. That's just a summary. Again, the daily exercise routines are very, very important. And it's not just doing it in indoor gyms. It's very, very essential that you also do some part of your exercise outdoors, so that you have that exposure to the sunshine, actually early morning sunshine, that can help with vitamin D synthesis in the body. So it's not a good thing to just do all your routine exercises within the confines of a room or a building. Outdoor exercises are very, very important. And something as minimum as walking 30 minutes a day can a lot of a difference. Hello, can you hear me?
Yes, we can hear you now. But I think your network is a bit sketchy.
Yeah, I'm so sorry. Yes, I got cut off. So, but you can hear me now. So
Yes.
I think I was talking about digital limits. Did you get that? Or
No.
Where did you lose me?
Exercise in the sun.
Exercise. Oh, I'm so sorry. I'd moved beyond that. So I was trying to emphasize the fact that daily routine exercises are very, very important, especially outdoor exercises. And even having to do as little as 30 minutes of walk outdoors per day can make a lot of difference in our body system. The next day I was trying to emphasize was about decrepitous. Now, decrepitous is the medical term for sleep or lying down. And we need really to promote sleep as part of our overall health and mental well-being. It's always recommended that the human being should sleep at least 4 to 6 hours in a day. Usually 6 hours is what we prefer. I know people are pushed to 8 hours, but in this day and age when we are so fast-paced and we're so busy, it may be a bit difficult to spend a third of a day sleeping. So, but 6 hours is actually reasonable enough to keep yourself going. We can't overemphasize about that. And closely related to decrepitous or sleep are digital limits, because most people spend a lot of time, especially night time, on social media. Lots of studies have shown that a lot of people spend a certain portion of the night on social media when they should be sleeping. And so, and the other harmful aspects of engaging in too much social media time to our health, the effects on our eyesight, being too close to the screen, and the fact that these devices also emit radiation. And we don't know the long-term effects of this. Nobody has really studied that, but we know that there's some form of radiation that gets emitted by many of our devices that we carry about. So we need to be very, very conscious of how much time we spend on our social media. Of course, dental care is very, very important. And on average, even that we recommend that people should brush their teeth at least twice a day, morning and night, we also recommend that people should have at least once a year or twice a year annual dental checkups. Just have a look at the teeth and be sure that everything is fine. And then, of course, doctor's visits should be routine. And we should have the habit of having a yearly medical checkup, even if you're not feeling ill, just to be sure that everything is fine, just to be sure that things are on track. And of course, I'll look to that later on. And then finally, I've reserved this to the last, doing the do. I'm sure most of us will be wondering, what exactly did I mean by that? Sexuality is very, very important. If you are sex deprived, it tends to affect both your physical and mental health, well-being. There are lots of studies that have shown that. And so once you find yourself having to abstain from sex for a long period of time, it gets to affect on a lot of things. And I'm sure lots of ladies will agree with me that this actually is a very important aspect of our lives. I know that people don't talk about it a lot, but sexuality and our health is a very, very important thing. So as women, we should also of this. Of course, the men do have a role to play in all of this, but there should be a balance. So I've given this brief overview of what I think call the 8Ds of regenerative towards in terms of our health building. Now, let me focus on October. Now, October is Breast Cancer Month, and breast cancer is a major cause of cancer deaths in women worldwide, and it's common cause of cancer in African women. And because this program is coming up in October, it was thought necessary and apt that we should discuss about breast cancer in detail because of the impacts. And as a cancer surgeon, I've seen this thing close up, and that's why I'm very passionate about discussion regarding to this. Now, we know that cancer is the leading cause of death worldwide, and in 2012, we accounted for 8.2 million deaths of percent of all deaths in that year. And if you count all the deaths from HIV/AIDS, from tuberculosis, from malaria together, they are still not up to the number of people who died from cancer in that year. And in 2010, it was estimated that about $1.16 trillion was spent on cancer care. And that's another estimation. And things are actually getting more intense as years have gone by. And in less developed countries like Nigeria, we tend to have the majority of the cancer burden. In 2012, more than half of the cancers that were detected were in less developed countries. And by 2030, it's estimated by 2/3 of all the cancers detected worldwide will be in less developed countries like Nigeria. Also, the number of deaths are also increasing. It's estimated by 2030, 7% of patients who die of cancer will die in countries like Nigeria. And so we really need to be aware of these issues. Now, why do we have this disparity between cancer deaths and cancer incidents in our setting compared to the more developed settings? One of the factors is because of the kind of disease that we see. I'm sorry I'm showing this, but these are the realities of life, that we're seeing younger and younger patients having cancers. In most Western world, they say cancers are disease of the elderly, but we see cancers in young and middle-aged patients in our country. On an average, most of our patients who have cancer, especially breast cancers, are 10 years younger than patients who are in the Western world. That the cancers usually are very aggressive. They have very, very bad biologies. They are also very, very advanced, and they are seen more in premenopausal women. Many of our patients have stage 3 and stage 4 cancers. And so these are issues that make treatment very, very difficult in our setting. The other thing that makes it very challenging is because of the environment where we live in. We have lots of people who are poor, who cannot afford regular health services, who are indigent, and the healthcare system is also very, very ineffective too. And so that also has accounted for the kind of mortalities and morbidities that we see in terms of cancer care in our environment. And to cap it all, we don't really know exactly what causes cancer and what's actually the most effective treatment. There's lots of research going on concerning this. And that's why we talk about risk factors rather than causes of cancer, including breast cancers. And so because of all of these things, it's actually better to prevent rather than to cure. So there's a need for awareness and preventive measures. And this will give us the best chance of being able to tackle this disease effectively. Now, it all starts from knowing the symptoms that can occur when somebody has breast cancer. Typically, we'll notice a breast lump, and the breast lump tends to be painless initially. And that's what makes people come late to the hospital, because they feel that once there is pain, you should appear to the hospital. But once it's painless, you can ignore it, you can manage it, you can live with it. And typically, breast cancer only becomes painful when it's far advanced. It could be some abnormal Purkinje sensation, it could be abnormal discharges. So women need to be aware of these symptoms. So the most common symptom is lump or a thickening of the breast. And like I said before, it's usually painless. Sometimes a woman can notice discharge or bleeding from the nipple. And once you see that, especially for somebody who is not breastfeeding, you need to go to see a doctor and find out where exactly is this happening. It may be something innocent, but at the same time, it may be something that could be more serious. Again, we could see changes in the appearance of the breast, either in the contour of the breast or the size of the breast. And that may be an early sign that something is happening sinister underneath. Again, we could notice that the nipple itself may appear abnormal. Instead of being protruded, it could actually sink in, what we call nipple inversion. Or could even have some changes in the appearance of the nipple, either in terms of the color or even the shape of the nipple. all these things women need to be aware of. Of course, there could be some redness over the skin or some pitching over the skin, like the back of an orange. We call that pure orange appearance. Once we see this, we need to be sure that there's something, whether there's something sinister or not happening beneath. So women need to be aware of these features. But as a general rule of thumb, once a woman notices something different from what she's used to in her breast, thereby seeing it or by feeling it, then you should seek prompt medical attention. It's better to be safe than to be sorry. Now, so in line of that, we recommend that for a woman who wants to be aware of her breast, she needs to examine herself at least once a month. Of course, if you can do it daily, every other day, weekly, it's probably better, but minimum is at least once a month. And for a woman who is breastfeeding, the best time to examine yourself is the week after your menses. So usually say a week after you finish your menses should be the best time to examine yourself. And then the best way to do it is to do it while you're taking a bath, so that your body is relaxed and you will be standing in front of a mirror to see. Whenever you see or feel something that appears abnormal, then you need to go to the hospital. In the hospital, the doctors will do what's called a clinical breast examination to confirm what you have seen and find out if there are any things you did not notice. And of course, scans and other tests could be recommended for evaluation. Usually for women who's less than 40 years, we recommend a breast ultrasound scan. The reason for that is beyond this discussion. And for women more than 40 years old, we recommend an X-ray of the breast. We call that a mammogram. And you can see this image of a woman who's undergoing mammography with the breast in between these radiological plates. Again, there are some 3 M's of mammography. We look out for masses, look out for microcalcifications, and look out for modified appearance of the breast. Again, this is beyond the discussion here, but there are things that we look out for to find out if there's any abnormality in that breast that needs to be addressed. Now, because I'm sure you can agree with me that having to do mammography may be uncomfortable because you are squashing the breast in between these 2 plates here. Some women don't like it, and some breasts are actually not amenable to that kind of procedure. So there are more gentle and more point of care friendly devices that you can use, like a probe, like a tube, place on top of the breast to see if there's any difference of blood flow in any part of the breast. And the assumption is that if there's something wrong happening in the breast, blood will try to gravitate that area to mop up the problem. And so if you can see difference in blood flow using some simple devices, you can help us know if there's something wrong in that breast. So there are certain commercially available devices like the iBreast or the breast eye that use that principle. And you may hear that or see that in the media. Now, because I always like this opportunity of discussing cervical cancer with breast cancer, I just could not help it, but I just had to drop in cervical cancer because, again, these are the 2 diseases that tend to affect women in particular. So a woman who has cervical cancer may have postmenopausal bleeding. So a woman who has ended her menses for a long period of time starts seeing bleeding again like menses. There's something wrong with the cervical cancer. Or an unpleasant vaginal it may be cervical cancer. A woman who has pain or after intercourse, that shouldn't occur in regular normal intercourse. A woman who has bleeding in between, a woman who has bleeding in between her periods, that may also be a sign of cervical cancer. And a woman who has low pelvic pain, God forbid anyone experiences this. And usually in terms of evaluation, we tend to do what's called a pap smear. I know people have heard about it to assess the cervix of the woman to see whether there's any abnormality there. And in terms of preventive strategies, we need to recommend vaccination against the virus that tends to cause cervical cancer. And that virus is human papilloma virus, HPV. And usually we recommend that this vaccination is given to young boys and young girls before they are in their preteen or teenage years. And that tends to reduce significantly the incidence of cervical cancer in many areas where this is practiced. And of course, safe sex and modalities, and these are for our younger individuals. Now, I'm going to come to the tail end of our discussion. So, WHO has recommended that there are certain specific ways to prevent breast cancer generally, making your homes healthy. That is very, very important. Again, encouraging breastfeeding, vaccination against hepatitis B and human papilloma virus, avoiding too much sun, using sun protection, reducing indoor and outdoor air pollution, being very active, limiting alcohol intake, alluded to that, and taking part in organized cancer screening programs. And that's where the issue of having regular, at least once a year, medical checkup comes into play. Again, I kind of emphasize the issue about diet. So taking carrots, taking spinach, taking cauliflower, taking broccoli, apples. These are very important things. But something as simple as water, lemon, oranges, grapes, they all are very healthy things that can help in preventing lots of cancers that has been proven scientifically. So in conclusion, health is the foundation on which wealth can complete respond. I've said that again. And I feel that having healthy lifestyle choices, including the 80s, are very, very essential for our businesses. Because like we have said, right from the very beginning, a healthy woman gives a healthy home, and a healthy home gives a healthy nation. A healthy entrepreneur has a healthy business, and a healthy business will thrive and last long. And because this is Breast Cancer Awareness Month, that's why we are focused on this today. Cancer is a clear and present danger, and awareness and preventive strategies are key in terms of managing this condition. So I want to end with this quote, that there are 3 C's about life. Life is about choices, about chances, and about changes. You must make a choice to take a chance, or your life will never change. I want us to take that choice today, to take that chance of being more conscious of our health so that we can have much changes in our health and in our businesses and the nation as a whole. Again, I'd like to thank you for this audience, and I'll be happy to take questions.
Thank you so much, Dr. Adeyeye, for that in-depth, though the time was short, but you were able to compress it and load us with a lot of information that we need at this time. Thank you so much. I think if you have any question, kindly post it in the chat group. I'm going to check that out and, read it out. But, one of the things that I might take away from here is the importance of being aware of your body. Sometimes as ladies, we are not as aware as we ought to be. It's being aware of your body and just ensuring that you know how everything is, and you can quickly note when there is something off. So ladies, take time to love yourself. Take time to, check your body very well, because at the end of the day, nobody might be able to do it for you, as nobody knows your body like you do it. From what is said, he mentioned that at least once a month. In fact, I wrote on my note, set an alarm once a month to check yourself. So if you're like me, that you're always very busy, please set an alarm and make it a recurring alarm to just check yourself in the bathroom, like, it's said. So I'm going to go to the chat room now to check some of the questions that we have here. Thank you. Everybody's just saying thank you, thank you, thank you. Oh, Debola Defiori said if your husband and your wife is not in the same country, well, I don't know. How many times can we take cervical vaccine, or is it just once in a lifetime? Doctor, please, can you explain that, how that goes for us?
Thank you so much for that question. So the vaccine against cervical C is best given before an individual engages in sex, because the human papillomavirus, that causes cervical cancer, is actually very prevalent amongst lots of people. But there are certain types of those viruses that can actually cause cancers. So the recommendation that before somebody engages in sex, that's when the patient should have the vaccination. And that's why the vaccination is usually given to young girls initially, but not even boys have been given that vaccine, usually in their preteen or early teen years. So, but if somebody who has not had sex, it is very difficult to recommend vaccination, because there's an assumption that person would have been exposed to the virus. So before vaccination be given to an adult who has engaged in sexual activity, they may have to carry out tests to see if they have been exposed to the virus, and if the virus that can cause cancer has been exposed to that person. Been exposed to the virus, then the vaccination is no longer useful. But if the person has not been exposed to the virus, then the vaccination will be useful to protect against the virus. So the issue of the vaccination is actually more important for the kids, but for the adults who probably want to have the vaccine, they may have to have tests to determine if they've had exposure to the virus before determining that. I hope that's answered the question.
Okay, thank you very much. There's another question here that says that when you talked about medical checkup once a year, can you list the specific checks so we know?
All right, thank you very much. Again, that's a very important question. So most regular health outfits have a package or a protocol for health checkups, because the health checkups depend on the age, depend on the gender, and depend on if the person has had any other medical condition for like hypertension or diabetes and the like. So for each category of individual, there's a package. So if I start reading out names of tests, then it may not be inclusive or maybe exclusive. But as a minimum for women, especially for women who are in their 30s and their 40s, as a minimum, we recommend that the woman should have a full blood count to see her blood levels, so that her blood levels are okay. To have a test to look at her kidney function tests, look at her liver function tests, do an ultrasound of the breasts, or a mammogram, depending on the age. Like I said before, younger than 40 years, we say ultrasound scan. More than 40 years, we say mammography. That's the X-ray of the breasts. And to do a pap smear, the woman has not done that. And usually, by the time a woman clocks 40, as women celebrate their 40th birthdays, we always encourage them that they should think about starting their well-being screening. In other countries, most of the countries like the UK, once a patient clocks a particular age, especially 50 years for them, they send a letter from the government or from the NHS congratulating on that age milestone, and then reminding them they have to start doing their checkups for cancer screening. So they have that postage done. And in fact, some of those tests are actually mailed to people's homes. You do the test and you send them back to the hospital, in a place where I practice. But of course, we don't have that set up here in Nigeria. So you have to do that on your own to go and seek that. But like I said at the beginning, most of these health screening tests are packaged based on the patient's age, gender, and pre-existing diseases or illnesses.
Okay. Thank you very much, sir. There's another question here. Ola Jumoke, she said, can we go for medical breast examination monthly?
I do not think it will be cost-effective or economical for one to go for monthly medical breast examination in a hospital. First of all, anybody who goes to the hospital for a medical examination will be competing with other patients who will need to see the same medical practitioner. And that's why the recommendation is that the medical examination in the hospital should be either of two settings. One, a woman who has been doing her regular breast examination discovered that there's something abnormal in her breast and she appears to the hospital, valid and is agreeable. Or two, the woman comes and says, I'm coming for my yearly medical examination, or which case the breast examination will be part of the medical checkup. So those are the two scenarios where a woman can present herself to the hospital in that kind of thing. But going there every once a month may not be economical.
Okay, thank you very much. I think one of the things, I decided, myself and my husband decided, was that every year, one of the birthday gifts we give to ourselves is full medical checkup. So by the time it's your birthday, as soon as you finish celebrating, you just carry yourself to the hospital for a full medical checkup so that at least you know your state of health as at that time. There's another question here from Ngozi, and I have something to say in line with that. So I have a friend that once mentioned that when she uses a particular brand of deodorant, or she uses roll-on, I think it's a roll-on, it gives her like a lump by her breast side. So she starts feeling some kind of lump at that side of her breast. But when she stops using that exact brand, it doesn't happen to her. So at that point, I was scared. I thought it was, could it be breast cancer or something? But since it was going and coming, we really did not know what it was. We just said probably that brand was not too good. So there's a question from Ngozi that says, I have a question concerning bleach lumps found in the breast. Do you advise it is taken out?
Okay, thank you. So very important question too. Whenever a woman has a lump in the breast, what we first decide is, what age are we seeing this woman? And is there any family history of breast cancer or anything that can suggest breast cancer? Typically, breast cancer is very, very rare in women below the age of 25, except there is a family history, a strong family history of breast cancer. Like we once treated in Life Hospital a lady, 22 years old, whose mother died of breast cancer, whose elder sister died of breast cancer, whose grandmother died of breast cancer. So it was obvious that there was a strong family history of breast cancer in that individual. And at the age of 22 years, she had breast cancer in both breasts. And we had to remove breasts. And last stuff, because this was a lady who was in her final year of university, who had all her life ahead of her. She had a fiancé, she was trying to get married. So we had to really, really address lots of issues around that. So, but that's an extreme. But generally speaking, it is very uncommon to see a lady less than 25 years having breast cancer. So if a woman is more than 25 years and now has a breast lump for the first time, then we are worried. And then definitely if a woman is in her 30s having a breast lump for the first time, then we have to really be sure that it's not breast cancer. And most of us, cancer surgeons, will prefer to remove the lump. It is better to be safe than to be sorry. Why would you do what 25? Why would you do number 25 years? Because a woman's breast is still developing from puberty up to the age of 25 years. And there are certain lumps that can happen in a developing breast that we call a fibroadenoma. Some women have heard of before, that can occur in a developing breast. It's a normal reaction of the breast trying to grow, outgrow themselves, and it may form a lump there. So anyone less than 25 years with a lump occurring for the first time, we're not too worried if there's no issue of breast cancer. But again, we never say never. But if a woman is more than 25 years, has a lump for the first time, then we recommend removal. If that lump is more than 3 centimeters in size, then we recommend to remove it. Not that because it can be cancerous, but once it gets to that size, it's unlikely for it to disappear on its own. It wants to grow and grow and grow. So it's better to remove it at that stage. So those are the two things that we look at when we determine removing breast lump or not. But of course, a thorough medical examination is important in determining all of this.
Okay. Thank you so much, Doctor. There is this other very, very important question, especially because the fact that we are speaking with women and a lot of women are doing family planning because we want to face our businesses. And, you know, there are two people that asked the question, Modukwe and Omutianya. The IUD, family planning, some people are saying that it can also increase the chances of having breast cancer. What do you have to say concerning this, sir?
Okay. Let's put it this way. There's what is called contraception, which is the method of preventing pregnancy. Now, the contraceptions are of different types. Now, there's a particular type that requires chemicals, which we call hormones, that will try to suppress pregnancy. It is those hormonal contraceptives that can predispose to breast cancer. And the hormonal contraceptives are usually the pills that we take once a day. So usually the oral combined pills. Now, it doesn't mean that if a woman starts taking the pills today, that she's at risk of having breast cancer. No. Usually the woman has to have taken the pills for at least 10 years on a consecutive basis. 10 years non-stop every day for it to be a predisposition to breast cancer. So it's a long-term use of those hormonal agents for contraception that are predisposed to breast cancer. The IUCD, as far as I'm concerned, do not contain the hormonal agents. We call it copper T. So it's actually the mechanical effect of the copper T, the T in the womb that prevents the ovum. I don't want to use medical terms here because I know it's not a medical gathering, from just seeding itself into the womb. So because those things don't contain hormonal agents, they don't predispose to breast cancer. What IUCD can cause is that because of the twine, the thread that we use to pull it out when it's time to be removed, if that thread is too long and is sticking out down to the vagina, it could introduce infection, and that can cause pelvic infection in the woman. If a woman gets pregnant and the IUD does not allow the pregnancy to stay inside the womb, the pregnancy can actually stay in the fallopian tube and can cause ectopic pregnancy. Those are uncommon, they are rare, and they are so rare that it's still safe to use an IUCD and many other forms of contraception. So, but in terms of breast cancer, no, IUCD.
Okay, thank you very much. Still on that, the use of implants has been on the rise for a while, but you didn't say anything concerning implants. You just said about the insection and the drugs. Yes. Okay. Please, can you talk about that a little?
Thank you. So I know I skipped that because I was trying to keep the time. I know that I'm not speaking to a medical audience, and I know that our attention span can drift after a while. So I didn't want to put too much information because the Madam President had warned me and had begged me not to spend time because I can spend this. This is what I do. I enjoy talking about stuff like this. So that's why I just skipped that. So, and I apologize for that. So, but it's true that even as we're encouraged to do the two, you also have to have the contraception at the backside too. So one of the contraceptives that people use are the implants, the nerve plants that you put under the skin, usually in the forearm of the non-dominant hand, or the arm of the non-dominant hand. So the issue about those implants are that they also contain hormonal agents. And, and those hormonal agents can also theoretically predispose to breast cancer, but not as much as the oral pills. The reason why is because those hormonal agents from the implants are slowly released over a period of time. So it's a slow release of the hormonal agents compared to the oral drugs that you take it to your system and it gets absorbed almost completely. So in terms of weighing the risk of breast cancer, it's more oral hormonal pills than the implants. So an increase in body size and obese, and a lot of men don't like that when they start noticing that those features. So those are usually the complaints that we see in terms of the implants.
Okay. Thank you very, very much, sir. There is one very funny question here. Where is it? Okay, Modupe said, why are men not encouraged to get vasectomy done since?
That's a very, very valid point, because like I said, I believe in women. I am pro women, and Madam President can bear with me that I'm her fan 110, 120, 200%. Anything that she wants to do that is good, and she always does good things, I am always in support of it. So, but
thank you very much. Please, can we jam our hands together for him? Thank you very much, sir.
But what I'm saying is more in the fact that I believe that what is good for the goose is good for the gander. So It shouldn't be that contraception should be about the women. Infertility shouldn't be about the women. It takes two to tango. So there should be that discussion that why can't men have vasectomy? Concerning vasectomy. Number one, vasectomy is a procedure. Then the patient has to go to hospital, go to like a theater. And many times, vasectomy can be irreversible, especially the longer the time between the time vasectomy was done and went to connect. So if you're going for vasectomy, even though there's a chance that you could reverse the vasectomy, no doctor will give you a 100% guarantee that the person will be able to reverse that vasectomy. And so it is something that you have to be sure that is what you want to do. Let me give an instance. When I was training, we also told this story about someone who had done a vasectomy, and then unfortunately, his whole family had a plane crash. When it was about the plane crash, and they all died. And the guy was left alone. Wanted to start another family again, but so the question is, where does it start from? Of course, there's that rule of trying to harvest sperm from his testes. But all those things are high-falutin stuff that have their own chances of failure and success. So because of that semi-permanence of vasectomy, that's why it's not so popular in this. But lots of people do it in the Western world. Well, I agree. It's something that should discuss. Because that should we consider vasectomy as part of contraception? It should be a discussion.
Wow. Thank you very much, sir. We are so grateful. Please, can we just drop thank you, sir? Thank you, doctor, on the chat. Thank you so much.
Thank you so much. Thank you all. Thank you so much.
This is such a loaded seminar that you've just given us this afternoon. Thank you. We are so grateful. So I also want to thank everybody that has stayed. Do you want to say something, sir?
Yes, I didn't want to say something. I wanted something that I knew that I was probably a bit fast at times, and then interrupted us. So I'm going to hand over the slides to the alumni so that you can have access to it. In case so we'll have access to the slides.
Thank you very much, sir. Thank you. We are so grateful. Thank you for your kind heart. Thank you so much, sir. I want to say a big thank you to everybody for staying. I can see Mr. Ibrahim is still here. Thank you. Thank you, Doing. Thank you, Mr. Mike. Thank you, IVLP President. Thank you, everyone, for staying till now. We are rounding up now, and we just want to say thank you, ladies. And we have an exciting news. Next month, we are having a physical meeting, and I am so excited. Guys, you have no idea. The place we are hosting it. It's a fresh place. It's a fresh American corner. You have no idea how excited we are to host everybody next month, 24th of November. So let's come prepared. Let's mark our calendars and block that day out. It's going to be huge fun. And then most importantly, because we are women here and we are entrepreneurs, and I believe that, I'm sure as business people, we started planning for December. We started planning for what we are going to be selling in December. So please, You can drop it right now before we go off. What is your plan for December? Are you selling rice at discounted rate so that we don't take inside money outside? Please drop it so that we can patronize you before we round off the meeting. But I just want to say thank you to everybody. Every woman here is awesome, and I'm so proud of everything that we are achieving. I would hand over to Dr. Yemisi, Madam President, for a closing remark.
Thank you so much. Vibrant, beautiful, able Jensek Adebisi Odeleye, the CEO of Mo Organics. This thing comes so natural to you. So you need to tell me later how you get to do this way. In fact, you just can keep us all day and we'll just keep loving, listening to you. Thank you so much. And I want to say a very big thank you to our guest speaker, Dr. Ademola Adeyeye. Thank you so much for such a brilliant presentation. I'm sure that if not for time, the awesome ladies of AWE will want to have you for more time to ask a lot of questions that's been on our mind. So in case there are other questions that you want to ask as a member of AWE or as our audience, and you are not able to ask or you feel it's too private, you can send a DM to me or to any of the ESCOs or seek an audience. And I want to believe that our guest speaker will magnanimously, give audience to one or two of us who would like to talk to you about some personal health issues. I know you charge a fee for that, but because of AWE, you're gonna do it for free. So I hope can we get your approval on that, sir? All right, so thank you so much, sir. That was a brilliant presentation. And I'm sure that we are going to go with all the information we have gathered today and practice them and also tell other people about these things. Health challenges should not, destroy our lives. We should seek help early and accept treatment early. And in that way, we'll be able to get, the cure or the management faster and have a very good life. Yesterday, I was at a market. I was invited by an NGO that took breast screening to a market in Ilorin, and I was invited to, to help them on the program. And, before we even started seeing everyone, by seeing like maybe 15 people, 10, 15 people, we're able to see one woman out of 10 people, 10, 15 people, one has breast lesion. In fact, the breast lesion was almost as big as this. And, she was just there selling her goods, enjoying her lives. And I told her, I said, this is the right time to treat this thing when nothing is happening already. So women that are in AWE, like our speaker has said, it's on the foundation of sound health or good health that you can build wealth, that you can build prosperity, that you can develop. Do not ignore anything. And don't be afraid. Fear is the reason why we don't pay attention to these things. Not only lack of funds sometimes. Don't be afraid, and that's what AWE is for. It's a network. You have a sister in us, you have a friend in us. You can talk to me. Please mute your mic. Thank you. So that you can get the help you need. Please, we want you to be healthy, and we too, as ESCOs, we want to be healthy. I want to say thank you to everyone, most especially to the public affairs section of the U.S. Consulate. Thank you everyone for coming, Mr. Ibrahim, Doyin, Jennifer, whoever is, because I can't see all the faces, but thank you. I want to say thank you to USGAA. I can see the president in the house, Mr. Mike. Thank you so much for coming, and to every other presidents and ESCOs or members of other exchange, U.S. government exchange alumni. Thank you so much for coming. And I can see other people who are not even part of USGAA, who are, friends and families of our members and associates. Thank you so much for coming. And please, let's be healthy and keep being healthy. And as we make money, we should not forget to take care of our health. And I would like to announce to us that our first network meeting, physical network meeting, is happening next month on the 25th. It's a Thursday. On the 25th, it's a Thursday, 25th, 10 a.m. at the newest American space. I'm sure you want to enjoy it. I've heard a lot about that space, so don't worry, I will be there. So you plan to be there. And please, for those of us who have not done, take care of our responsibilities as members of the Alumni, AWE Alumni Association, you know what I'm talking about. Please do that. And if you have products that you want to exhibit during this physical network meeting, please get in touch with the financial secretary or the treasurer so that you can register your interest, because we'll be exhibiting our products. That's the beautiful thing about AWE. Other exchange alumni, they will just come and talk. We will talk and we will do. So you come and show what you have. Let's buy from you. Christmas is coming. I would like to get some pieces from you or whatever you're doing. So those who have products, so if you have a way of displaying, just get in touch with the financial secretary or the treasurer. They are in charge of the registration for it. You are not paying for exhibition, but it's going to be first come, first serve basis because of the limit of that space. So you're not paying for exhibiting, but you must have done your responsibility as a responsible member of our association. And I know you understand what I'm saying. Thank you so much, Mr. Stephen Ibeli, and every other person that has made today a beautiful time. And don't forget, please block your calendar, set a reminder. Thursday, 25th of November, 2021 is our first physical network meeting. And guess what we are talking about? You will love it. You will love it. We are talking about how you can get grants for your project. Every business have different projects you do at different times, things that you want to put money into. So you don't want to take a loan, you want grants. So come and hear from people who have had up to like $5 million as grants inside their portfolio. We are bringing fantastic facilitators. You don't want to miss it for anything. I'm not going to miss it by the grace of God. So you too, make up your mind that you will not miss it. Thank you so much, everyone. And I think we can call it a day. God bless you all and see you soon.